Good morning, everyone. How are we all? Just going to give everyone a few seconds just to join in. I can see those numbers are rising. People are joining, so we'll start in a few seconds. All right, welcome everybody. Thank you for joining us today for our Tuesdays at 10. Hopefully everyone enjoyed last month's one on prepping our skins for peels and those advanced modalities, which is particularly relevant right now. We're in peel season, it's nice and cool. If you didn't get a chance to join us last month, then we do have our Tuesdays at 10 recorded, and you can go back and rewatch them whenever you want to. So I think we'll get started. So again, thank you everyone for joining us today. We are very happy and excited for you to be joining us. We've got a new topic for you today. So for those of you who don't know me, my name is Rachel and I am one of the New South Wales trainers here at Professional Beauty Solutions. I also have Kim joining us today, and she is one of our New South Wales trainers as well. So she's sitting in the background with me today. Now, if anybody wants to comment today or ask any questions, both Kim and I are going to be monitoring that chat. So if you want to put your questions in the chat box or the Q&A box, just make sure that you do select reply to everyone so that everyone gets to see your great questions and the answers as well. All right, so let's have a look at some of the upcoming topics that we have with our Tuesdays at 10. So for those of you, if this is your first time with us, or if you're not overly familiar with Tuesdays at 10, every month, the first Tuesday of every month at 10 a.m, we come to you live with to share a really hot topic. We have covered topics so far such as how to prep your skin, skin barrier function. We've gone through advanced consultations. So today we're going to be looking at targeting specific skin conditions or concerns. And we're really going to explore 4 of the really common skin concerns that we see in clinic and start to get an overview of how we would identify these skin concerns and how we would go about approaching those skin concerns and how we can start treating them successfully and what sort of ingredients that they need in their skincare diets. Then next month, we are going to be doing a bit of a deep dive into pigmentation. And I know that one's a really hot topic and a really tricky one to treat as well. So we're going to look at the different types of pigmentation, really delve into it, look at melanogenesis. We're going to go through the different causes and how to really treat them and those different types of pigmentation, not only with that skincare diet, but those advanced modalities when your client comes into clinic as well. And then in August, we're going to do a deep dive on acne. So looking at the different grades, the different types of acne, looking at those root causes and how we can really effectively treat all grades of acne that walk through our door, through our clinic's door, because it can be also a tough one to treat. Now, if anyone does have a topic that they would like us to cover, please pop that down into the chat. We would love to hear what topics you would love us to cover, and would be very happy to look in that and see if we can pop something a bit more tailored for you guys as well. All right, so let's have a look at the big 4. So these are 4 of the most common skin concerns that walk through our clinic's doors. We're going to go through more of an overview today. Like I said, we're going to go through those common causes, how we can identify different types. And we really want to go into getting our clients' skincare diet, getting them on that correct regime, getting them on that correct skincare diet with all those ingredients to really feed and nourish and treat that skin. So we are going to have a look at the aging process and things that affect it, have a look at those ingredients that we want to be feeding our skin, feeding our client's skin to really start to effectively treat that. We're then going to have a look at pigmentation. So some of the different causes of pigmentation, such as hormonal or environmental. Then we're going to go into acne and how acne is formed and those ingredients that we need to not only kill that P. acnes bacteria, but to also reduce that inflammation that we commonly find together with acne. Then lastly, we're going to go through rosacea. We are going to look at 4 common subtypes of rosacea that we may see in clinic and how to tell the difference between them all. So let's have a look at the aging process to start off with. So the aging process can be divided into 2 main categories. We have our intrinsic aging, which is our chronological aging, and then we have our extrinsic aging, so our environmental aging, our external factors that are affecting the aging process. Now, having a look here and looking at the characteristics and the differences between your intrinsic and your photoaging or your extrinsic aging. Now, overall, when we're talking about intrinsic aging, we're going to get a slowdown in that metabolic process. Things start to slow down. Things don't produce the way that they used to. The appearance of someone who is going through intrinsic aging, they have quite smooth skin. It's generally unblemished, but there is a loss of elasticity and we see that droop. We see those fine lines. They have a bit of a paler appearance as well and not much pigmentation coming through. And it typically sets in around that 50, 60 years of age. Going into the dermis, when we're looking at intrinsic aging, it starts to thin with age. So around that 50, 60s, it's going to start to thin out. We have that lower cellular activity. We have breakdown in elastin and collagen. We have that mature collagen that's going to degrade a lot faster. We also find that we don't have a lot of pinkness in the skin. I said it gets quite pale. So we get a slowdown and a decrease of that microcirculation in those microvessels. When we're then looking at photoaging or our extrinsic aging, those external factors, typically these skins present with an increase in metabolic rate. The skins are often quite rough in texture. They're quite leathery. They're quite coarse. There's really deep static sort of wrinkles that you can see in there. So think of someone that has been out in the sun all their life and they've got that leather handbag sort of skin or crocodile sort of skin. This onsets as early as late teens. So it is really important to educate our client on how to look after their skin because we want to age gracefully, don't we? Then looking into the, looking into the epidermis and your dermis, you're going to see a breakdown of the collagen and elastin fibers. We will also see those blood vessels become quite dilated. So we see a lot of broken capillaries on the surface of those clients' skin. Now, our intrinsic aging, so remember that is our genetic aging. It's determined by our genes, our DNA. It's our pre-programmed aging. It's what we're destined for. And that really is about 20% of that aging process, which means our extrinsic aging really is responsible for that premature aging. And it's why it's so important to really educate your clients on what they need to do, not only at home, but in clinic to prevent that aging process and to slow it down. So your intrinsic aging is that natural process. It starts from the very first day that we're born, and it can be very difficult to control. We do see that intrinsic aging kicking in particularly from around 35. That's when everything starts to slow down. That collagen synthesis, that elastin synthesis, that hyaluronic acid synthesis, everything starts to slow down. The stimulation of those fibroblasts start to slow down. They don't produce as much of that collagen, elastin, and hyaluronic acid. And we see that as that age progresses. Then looking at our extrinsic aging. So this is responsible for about 80% of that aging process. And this is something we can control. So it's something that we can do something about, which is brilliant news. And there's lots of different factors that can affect that extrinsic aging. We have our UVA and our UVB rays. So our UVB rays are out when that sun's out, and that's our most superficial UV ray. It is going to cause that burning, that sunburn effect, whereas our UVA rays are present all the time. They're present even on that cloudy day, and they go deeper into the skin and actually damage that skin. They cause loss of firmness and breakdown of collagen as well. We also have our infrared rays, which cause free radical damage and accelerate that aging process even further. We have our HEV rays, so our high energy visible light, and this is also known as the blue light, which is not only emitted from the sun, but it's also emitted by your smartphones, your tablet, your computer screen, your TV. So this is our digital aging, and we do need to protect against that as well. Other environmental factors are things like pollution. So if we live in a high pollutant area in the big cities, smoking, vaping, and poor diet can also affect that extrinsic aging. Other things like gravity or those repetitive muscle contractions, and we can see that really clearly on people who are quite expressional in how they talk and smile. You'll see that they have sometimes more pronounced marionette lines or more pronounced crow's feet. Hormones are another thing that can affect that extrinsic aging, be that from medication that we take or maybe lifestyle. Say if we're in quite a highly stressed environment or a highly stressed job, we're going to have higher amounts of cortisol release, so our stress hormone released and produced, and that's going to contribute to the breakdown of that collagen and that elastin, that dermal mattress. Dips and increases and just changes and fluctuations in things such as estrogen, progesterone, and testosterone can all have effects on the skin, like darkening of the skin, increase in acne, changes in sebum production, and loss of elasticity and firmness. So if our bodies are in a constant state of inflammation and fighting off free radical damage, we get oxidation, and that leads to the degradation of dermal matrix, or that mattress, that plumpness of our skin. So we're going to get a breakdown of collagen, of elastin, which is going to lead to that skin laxity and those wrinkles. So what are free radicals then? Free radicals are little atoms or molecules, and they are highly reactive with other cellular structures within the body and within the skin, and they contain an unpaired electron. Now, free radicals cause damage to parts of the cells such as proteins, such as that DNA and that cellular membrane, and it does this by going along and it steals a little electron from that little healthy cell, and this process is called oxidation. You can see in the picture on here that you have your normal little healthy cell who's then attacked by a mean little free radical and then has left that cell with that oxidative stress. It's flat, it's lifeless, and it doesn't look too happy at all. So how do we combat free radicals? How do we combat that extrinsic aging? With antioxidants, and lots of them, antioxidants galore. So antioxidants are going to go in there and they are going to neutralize free radicals by donating one of their electrons from the outer shell. This then ends that electron stealing reaction and neutralizes that free radical. So the free radical is then happy to go on its little day. Now, the antioxidants themselves don't become free radicals by donating that electron, and the reason is because they are stable in either form. They act a bit like scavengers. They are helping to prevent cell and tissue damage that could lead to cellular damage and disease. So vitamins such as vitamins A, C, and E are just some really known, well-known examples of powerful antioxidants that is going to protect not only the body, but also the skin from the destructive effects of free radicals. Now look into those ingredients that we really want to target that aging skin. These are ingredients that we want to look in our skincare diet, what we're going to recommend to our clients to take home to use on their face every day, and what ingredients we want to use in clinic as well. So we want to use retinols. So this is a vitamin A derivative. It is a very powerful antioxidant. It's going to help with cellular turnover, but it's also going to help to synthesize collagen. We then have our AHAs and our BHAs, and they're going to stimulate that cellular turnover. They're going to reveal that really smooth, younger looking skin. We want peptides in their skincare diet. This is going to help to not only inhibit facial muscle contractions, but it's also going to mimic natural processes in the skin. So we have peptides that stimulate collagen. We have peptides that mimic that retinol-like effect and also help to lighten up pigmentation. We also need our UVA and our UVB protection. It's going to prevent that damage from those UV rays during the day. It's also going to prevent that breakdown of collagen and elastin, and also excess melanin production too. Antioxidants, we all know they are going to fight those free radicals. They are extremely important for all skin types, but in particular, if we're wanting to combat aging, we need those antioxidants in there. We also want to get some plant-derived stem cells in there, and it's really going to then protect the longevity of those healthy cells. All right, so now let's have a look at those pigment concerns. Now, there's a number of different causes of pigmentation. We have things such as how hormonal or our melasma. We have environmental causes, and we also have our PAH or our post-inflammatory hyperpigmentation. So we're going to have a look at that environmental effect of pigmentation on the skin. And sometimes it can be a little tricky to really and truly identify and see pigmentation on the skin. It's not always obvious. It can sometimes be underlying in our skin from damage that we caused years ago. So when we are trying to identify different types of pigmentation and get a really clear picture, it's really useful and really important to have our analytic tools with us. So things such as your Woods lamps, your Observes, or even your BT zooms are all going to help us to have a closer look and have a look of what's happening underneath that skin's surface. This is a fantastic photo and an example of what those analytic tools can really help us see. And you can see here, using it, we can really see that sun damage, that underlying sun damage below that skin surface, which otherwise would have been a little bit naked to the eye. So having a look at how UV damage is actually formed. Now we have our little melanocyte, and that is located at the basal layer of the epidermis. And our melanocyte produces melanin, which is a single granule of pigment. Melanosomes are clusters of melanin. Watch me get tongue-tied here as well. So your little melanocyte kind of looks like an upside down octopus. He's got his little body or his base that sits in that basal layer. And then he has little tentacles or little dendrites that go up and around over the keratocytes and deposit melanosomes on top of the keratocytes, kind of like a little cap, like a little umbrella. And that protects the nucleus or the DNA of that little cell. So when we go out into the sun, it triggers the melanocyte to release tyrosinase, and this is going to stimulate that melanin production. Now, once that melanin is produced, it is transported then to the upper layers of the skin, which results in that skin discoloration. Your hormonal pigment can be really difficult to treat because of that hormonal connection. Melasma, cloasma, pregnancy mask, there's a lot of different names for it. It can be caused from pregnancy, menopause, hormone replacement therapy, oral contraceptives as well. Melasma is a specific type of facial pigmentation, and it is almost exclusively in females and generally presents itself on the cheeks, above the eyebrows, above the lip, and on the jawline as well. And it can be presented as quite mild and really hard to diagnose when it is mild, which is when those diagnostic tools will come in. Other times it can be quite severe and quite obvious that someone's presenting with that melasma. It's also called that mask of pregnancy, and it's caused by a combination of hormones, predominantly estrogen, from pregnancy or birth control, along with sun exposure as well. Now, once it starts, melasma tends to reoccur very easily with minimal amounts of sun exposure, even if that hormonal trigger has then been removed. So even if we come off those oral contraceptives, or even if we're not pregnant anymore, it can still be really easily simulated. Then we have our inflammatory effect. So this is our post-inflammatory hyperpigmentation, or our PIH, and this is often caused from trauma in the skin. So things like acne, burns, bug bites, inflammatory skin conditions can cause it, and even the misuse of those advanced modalities such as lasers, IPLs, and peels if that skin isn't prepped properly. Now, while all skin has the same number of melanosomes, in higher Fitzpatrick's, each melanosome has the ability to actually produce more melanin. So inflammation and injury to the skin triggers that melanin formation, and generally we'll find our higher Fitzpatrick skin types have a higher risk or a predisposition to developing PIH. So it's why we need to be really careful when we're treating those skins. Looking then at ingredients that we really want to pop into clients that are suffering from pigmentation. We want to do things like exfoliate to lift up that pigmentation. We want to inhibit tyrosinase. So we want our tyrosinase inhibitors in there. We want to stimulate cellular turnover. We also want to protect that skin and keep it healthy, keep those little melanocytes healthy as well. So we want ingredients in there such as kojic acid. I love kojic acid. It is a natural skin brightener. It's also going to inhibit that tyrosinase. We want daisy flower in there. So this is going to help inhibit melanogenesis. It's really, really effective at evening out that melanin production. Tranexamic acid is a non-exfoliating acid, and it helps to reduce that pigmentation and really clears up that skin. It gives us great skin clarity. We want AHAs and BHAs in there. As that pigment moves up, as those keratocytes mature up through the skin and bring that pigment up, we need those AHAs and those BHAs in there to increase that cellular turnover and help to slough it off. We want our UVA and UVB protection. So we want that broad spectrum protection in there, and that's going to prevent that further pigmentation. It's going to stop our melanocytes going into overdrive, trying to protect our little keratocytes in the skin. Dermapep is a really great ingredient that is going to help to brighten the skin, but also protect against UV damage. Sephora White is also going to modulate that melanin formation, so it doesn't go into overdrive. It's also going to help to correct those dark spots and discoloration in the skin. And then we want enzymes in there as well. They're going to help to digest cells without causing any inflammation in the skin, so particularly relevant when we're treating those clients with PIH. Now looking into acne. So acne is a really common condition, and it doesn't just affect those teens going through puberty. It can go all the way through to adulthood as well. We have some things like our hormonal acne, our P. acne bacteria, and pollution as well. So hormones influence the development and the function of human skin, which also produces and releases hormones. In puberty, we see hormones rising. In menopause, we see those hormones are starting to diminish. In pregnancy, we see hormones fluctuating and going everywhere. And then we've also got things like birth control and hormone replacement therapy as well that can affect those hormonal levels. So when it comes to acne, the androgen that's in charge of this, or acne itself, is testosterone. Now, men and women both produce testosterone and estrogen, and both sexes need it. However, women are often quite sensitive to extra amounts of testosterone in their bodies because they can't use it for normal functioning. Now, that excess testosterone can't just sit around. It has to go into circulation. It has to go somewhere. Enters in the skin. The skin has androgen receptors, cells in the skin, and this is where that excess testosterone is going to go, and it's where it's going to be purged. So the skin gets rid of it with those cystic sort of breakouts. That's how it manifests itself. Testosterone in the bloodstream also increases things like sebum production, so excessively oily skin. And that sebum can also then lead to clogging of that follicle and causing that breakout to be even worse than what it was. Now, looking at our P. acne bacteria. So P. acnes is a bacteria that is going to grow deep inside the pore, and we can see a little picture of it there. This is where it is going to feed on sebum, and that is produced in that sebaceous gland, and it's surrounding the base of the hair shaft. Now, most individuals with acne symptoms have an overgrowth of that P. acne bacteria in their skin. Acne is generally caused by the overproduction of oil plus the accumulation of epithelial cells on the surface of the epidermis that then shed in that follicle and create a clog. This clogged pore then doesn't allow oxygen to flow down into the follicle to where that P. acne bacteria is. And we know that P. acne bacteria really loves an oxygen depleted environment. So it's just going to swarm and grow and multiply. So the follicle then becomes full, it then breaks and it spills its contents into that dermis and the epidermis, which causes that then inflammation, which results in the loss of collagen and acne scars. And then we have pollution and acne. So pollution and the skin. So the air that we breathe goes through a series of tubes that are lined with the body's natural defenses to pull out toxic elements and to clean it. Now, those tubes, or the bronchioles, then get smaller and smaller and smaller until they end in millions of microscopic air sacs or alveoli. Now, that supply the blood with clean air. Now, capillaries are everywhere in your body, and they need a steady supply of blood. They are where that oxygen carbon dioxide exchange happens, and they supply the nutrients and help to carry those impurities to the elimination systems. Now, when impurities make it into the capillary beds, the skin's immunocell then purges it, and that's how acne is formed through that pollution effect as well. So when we're looking at ingredients to really target someone who has acne, we want things like salicylic acid in there. So our BHA, that is going to help to slow down that sebaceous activity and also help to exfoliate the skin and really unclog that pore. Benzoyl peroxide is extremely useful, and it's going to kill that P. acne bacteria inside those pores. So that overgrowth of bacteria, we need that for. We have our Granactive Acne, which also helps to kill that P. acne bacteria. It's going to also reduce the lesion count, especially when it's paired with either salicylic acid or benzoyl peroxide. Sebulus is derived from lilac, and that is going to help to reduce excess sebum production. It's also antimicrobial and antibacterial as well. Retinol, again, our vitamin A in there, not only is it an antioxidant, it's also going to exfoliate the skin, and it's going to increase that cellular turnover. So it's going to help to unclog those congested pores. And tea tree oil, another really good one because of that natural antibacterial and antiseptic property. The other thing when we are treating acne, and something that we often forget about because we see those pustules and those comedones and we just want to get right in there, is we need to look at inflammation in the skin. And more often than not, we need to start on that inflammation first, bringing that inflammation down, and then we can move into treating that overgrowth of bacteria or the hormonal effect or that pollution. So lastly, we're going to have a look at rosacea. Now, there's a few different subtypes that we're going to go through. We'll have a look at those triggers and also how to differentiate between the acne or rosacea, because sometimes it can be a little bit tricky. So rosacea is a long-term inflammatory skin condition that causes reddened skin, a rash, and it's usually presented on the nose and cheeks. It can also sometimes cause eye problems too. Now, the symptoms typically come and go. So you'll see someone who's suffering from rosacea will often have flare-ups, and certain factors such as spending time in the sun, experiencing emotional stress, sometimes foods that we eat, getting overheated, can bring on these experiences. So rosacea can be controlled, but we can never cure it. So we're just controlling the symptoms for our rosacea sufferers. Rosacea can be divided into 4 subtypes. So we've got our erythematotelangiectasia rosacea, we've got our papulopustular rosacea, we've got our phytomus rosacea, and we've got our ocular rosacea. So we're going to go through each one of those. So our first one here is also known as our dry rosacea, and this is quite a typical one that we do see. You see that persistent redness, that flushing. We generally get small blood vessels that may also become visible. Our clients often have stinging, burning sort of sensation, sometimes a bit of swelling there as well. It's often really rough and scaly as well, hence why it's that dry sort of rosacea. Our next subtype is our papulopustular rosacea. So this again is also known as acne rosacea, and it can be sometimes a little bit hard to differentiate between if it's acne or papulopustular rosacea. And I'm going to do a comparison in just a moment. But this one, your papulopustular rosacea, in addition to that persistent redness, also has those little bumps, those little pustules. Some patients also experience red raised patches on the skin as well, known as plaques. So acne and rosacea are separate conditions, and rosacea that presents with bumps and pimples is your subtype 2, so your papulopustular rosacea. And historically, it's referred to as that acne rosacea. Generally, the areas that are effective, if it's that papulopustular rosacea, is usually that face region. It's kind of confined to that area on the cheeks and on the nose, sometimes the chin and the forehead. They typically start as redness with tiny dilated blood vessels that then can turn into little bumps and pimples that can appear like inflammation as well. When we're looking at acne, this, whilst primarily we see it on the face, it can also affect things like the chest, the back, the shoulders as well. We normally have a variety of different lesions on our acneic clients. So we'll have our open and closed comedones, we'll have papules, we'll have pustules, cysts and nodules as well. The skin is often quite oily as well because there's that overproduction of that sebaceous activities too. So our subtype 3 is our phytomatous rosacea. Now, this can be caused from an alcohol allergy, from mites in the skin as well, and it's associated with an enlargement of the nose from excess tissue. This can include the thickening of the skin. It can be quite irregular in texture as well, and in really rare cases, it can develop other areas than just the nose itself. And subtype 4 is our ocular rosacea. Now, this is generally a hereditary rosacea. It can be influenced by environmental factors, and often there's a bacteria involved in it as well. So it's rosacea that affects the eyes, and it can result in really watery or bloodshot eyes or bloodshot appearance in the eyes, irritation, burning, and stinging as well. The eyelids can also become swollen, and styes are really common in this type of rosacea. So when we're wanting to look at ingredients that are really going to target that redness, that rosacea, that inflammation in the skin, we want ingredients such as soapwort. Now, soapwort is an amazing botanical. It is soothing, and it also has really powerful anti-itch properties. So it's going to bring that itchiness, that tightness down in the skin. Green tea is another brilliant one. So this is a very powerful antioxidant. It's going to fight free radical damage. It's also going to help in that inflammatory response. So it's going to help to bring that down, that inflammation, and really calm and nourish and soothe that skin, which is what those rosacea clients need. Centella stem cells are going to help to rebuild and strengthen that capillary wall, which means in turn it's going to help to reduce that redness. It's also a vasoconstrictor. We have our BVOSC, which is also known as our tetrahexyl decylascorbate, and this is an extremely stable form of vitamin C. It's an oil-soluble form. It is non-irritating. It is going to reduce redness in the skin. It is an extremely powerful antioxidant, and it's also going to reduce that inflammation as well and take that heat out. Linoleic acid is another one. So that's going to improve moisture and hydration in the skin. If you think about those rosacea clients, they're often depleted of hydration. They're quite dry. And vitamin E as well is going to help with that anti-inflammatory effect. It's going to help with that wound healing. It's also another powerful antioxidant that we want to get into our clients' skincare diets. So we want to prescribe the right regime for our clients. So we always want to start with the basics. We want to start with that healthy skincare diet and really focusing on those ingredients that we've gone through today for those different skin concerns. We want to get that into their skincare diet so they're feeding their skin daily with those really powerful ingredients to really combat those concerns. We want to take a progressive approach rather than an aggressive approach. So we don't want to go in there with full guns blazing. We need to take a step back and start slowly. This is going to be a journey with you and your client, not a race. They're going to be with you for the long term, but that is going to build up client rapport, client trust, and they will be with you forever. We want to concentrate on a chief concern and their chief concern as well. So whilst a client may present with us and we see all sorts of things on their skin, we need to go with what their biggest concern is first and really hone in on there. We also don't want to treat too many concerns. I normally say no more than 2 concerns that I'm treating at any one go. And that's because we can really effectively treat 2. If we start treating 3, 4, 5, 6, we're not going to treat it as well. We're not going to get those results from the client. And then we're going to get a bit of lack of trust because they're thinking that we can't do what we need to do. When we do start up with prescribing that skincare regime, we want to check back in with our clients. So get them to come back in after about a fortnight, reevaluate what's happening with the skin. Have we seen an improvement? Has nothing happened? Do we need to change up those ingredients, that skincare diet a little bit? And then we can also start planning those in-clinic treatments to really combat and really fight those concerns that your client is wanting to fight. We want to treat the skin and the person in the skin as well. I think sometimes we forget that there's a person behind all of this skin, and it can be quite an emotional journey. Particularly things like long-suffering acneic clients. It's a really emotional journey to get rid of that acne. It may have affected them for quite some time. So not only treating that skin, but make sure you're treating that person as well. We also want to make sure that we're recommending those products and that they know how to use them as well. Don't just send them home with those products. You really want to talk to them through those ingredients and how they're going to really benefit and what they're going to do to the skin for their particular concern. All righty, so I'm just going to have a look on here. If anyone has any sort of questions, pop them into the chat box here. I'm just going to have a look. I think Kim's been on the chat as well. Kim, do we have anything that we need to run through, or have you been able to get to most of them?
Yeah, there's a question from Hannah who's asked about whether we can recommend Image MD skincare for aging rosacea.
Yeah, so Kim just asked for aging rosacea, are we able to recommend Image MD, was it?
Yeah.
Image MD skincare. Absolutely, we can recommend that to our aging and rosacea clients. With the rosacea clients, though, I don't like to go in full guns blazing with all my actives. I do want to take a little bit of a step back. Firstly, working on that inflammation. So really soothing and nourishing that skin, not putting too many acids or retinols and things in there straight away. They'd also really benefit from a course of LEDs as well. And then you can go in with those more actives to go in there and really treat that skin. Anything else you can see?
Yeah, we have another question. What image products do we recommend for rosacea?
So the best image products for rosacea, we've got 2 collections that work really well. So we have our Vital C range. Now, Vital C range was originally made for that redness and for those rosacea skin types, and it has a huge amount of vitamin C in there. So it's got extremely powerful antioxidants. It's got anti-inflammatories in there as well. It's also got our tetrahexyl ascorbate, which is that really stable form of vitamin C, and that is going to help to feed the skin, calm the skin, and soothe the skin. The other range that would be really beneficial for your rosacea clients is your biome range. So the range we just released it only a few months ago. That is all about protecting the microbiome of the skin and the skin barrier. So again, it's going to just calm and feed and rebalance that microbiome, which particularly with your rosacea clients can be quite out of whack as well. So those would be the two collections that I would be heading towards if I've got my rosacea client coming in. If I've also got someone who's presenting with that papulopustular rosacea, we may want to look a little bit possibly at either Ormetic or Clear Cell. They may be able to help as well as there, but I'd be a little bit reserved. I wouldn't be putting them all onto that collection. All right. Okay, so we might just leave that one there. You guys have had some great questions come in. If we have not been able to answer your questions, don't worry. I will get back to you all. I'll email you all out with answers from those questions. So thank you so much for joining us today. We really appreciate it. Like I said, if anybody has any topics that they would like us to cover, anything in particular, please either reach out via that chat function, or you can reach out to head office as well and email us directly. Hope you all enjoy your day. Thank you again so much for joining us, and we will be seeing you next month, first Tuesday of next month at 10 a.m. and we're going to go through all things pigmentation.